Thanks, Dr. Ericus. Hello, audience. I am Zhang Xian from Tengzhou Central People's Hospital. Very much for the invitation from CCMA&SIO and ECHO company. My topic today is CT-guided microwave ablation combined with osteoplasty for treatment of spinal metastases. Because I don't speak English very well, my colleague Dr. Wu Lin will give the presentation of half me. Thank you.
Okay, thank you, Professor Zhang. It is my honor to introduce Professor Zhang's work in this field. The topic of our presentation is clinical experience about combination of microwave ablation and osteoplasty for treatment of spinal metastases. The incidence of bone metastasis was 30 to 40%, and for example, 50% of lung cancer patients were found bone metastasis by autopsy. So the incidence of bone metastasis was very high. The most common site of bone metastasis is in the end of spine and trunk, accounting for 50% of the spine, 25% of the femur, and 12% of the ribs and sternum. Bone metastasis lead to severe pain, pathological compression fractures, and even compression of the spinal cord leading to paralysis. The lives of cancer patients are significantly impacted by spinal metastasis, which often result in severe pain and neurological disability. So the primary goal of treatment is to reduce pain, enhance both stability, and control the tumor progression to get high quality of life. In recent years, imaging-guided percutaneous ablation have been widely used in the treatment of bone metastases. The effect of ablation in reducing pain is attributable to the following mechanisms. 1. Destruction of pain nerve fibers to reduce pain transmission. 2. Reduction in the size of tumor with reduced transmission of pain via the nerve endings. 3. Decreased osteoclastic activity and calculative necrosis of the tumor cells. D. Decreased in the production of nerve-stimulating cytokines, such as interleukins and the tumor necrosis factor. Osteoplasty can enhance both stability and had a good effect on preventing and treating pathological fractures. So we carried out the study of the two technology combination, microwave ablation plus osteoplasty, have the synergistic anti-tumor and analgesic effect. Both can increase the bone stability and reduce the occurrence of pathological fractures, and ablation can significantly reduce the leakage of the bone. We found some literatures and medical evidence. First, this article was published in the 2015 for extraspinal bone metastasis, 26 cases, and the VS score of these patients before and after operation had significant differences. And Dr. Chu of our team published another article on GVIR in 2019, which is a further summary of it. Both the VS score and ODI score were down significantly. And there is also a corresponding literature on spinal metastasis in 2018. Our conclusions are nearly the same. We use photos to show the process of the operation. These are our surgical instruments, such as Boltzmann high-pressure injector, bone puncture system, Boltzmann pusher system, microwave ablation antenna, and so on. All operations were performed under the guidance of CT. So this is our large aperture CT. And we use lidocaine for local anesthesia. After the anesthesia, bone needle was inserted into the lesion under imaging guidance. We often use orthopedic hammers. Subsequently, a single 14 or 16 gauge microwave ablation antenna was coaxially inserted into the tumor and make the ablation. Immediately after the microwave ablation procedure, several 1 milliliter syringes were used to extract the paste cement that placed in ice physiological sealings prepared in advance. Bone cement was injected into the position of ablative lesion slowly, in benches and in small amounts through a bone puncture needle. We choose such as 1 milliliter syringes, bone cement push rods, or high-pressure cement syringes to inject the bone cement. The surgical approach is usually through the pedicle of the ventral transverse joint or paravertebral. Choose one side or both sides according to the case. These are our photos about our approach. And the ablation parameters we choose are the power is from 20 to 50 watts, and the time is 3 to 6 minutes. In general, there is no more than 6 milliliters of thoracic vertebral and no more than 8 milliliters of lumbar vertebral. We like bone cement covers the affected area as much as possible and without leaking. Let's take a look at some typical cases. Intact posterior margin of vertebral body. This is a 33-year-old patient with lung cancer. The location of the metastatic tumor is at 7th thoracic vertebral. Before the operation, the VAS is 7, and Franco grade for spinal cord injury is grade E. Post-procedure, 48 hours, the VAS is 2, and 72 hours, the VAS is 0. Surgical and coronal CT showed osteolytic metastasis of T7 with intact posterior margin. And the way we are going to do that is bilateral transverse joints. Repeated CT scan and reconstruction as imaging guided. The bone puncture needle is located in the center of the vertebral body. And the microwave antenna is located in the center of the vertebral body. The ablation power is 30 watts and the time is 3 minutes. Bone cement, 7 milliliters through bilateral injection. Bone cement fills the whole vertebral body without leakage. Surgical reconstruction CT shows a good deposition of the bone cement and a small amount of bone cement leaked to the intervertebral disc. Coronal reconstruction CT is also the same. Next is incomplete posterior margin of vertebral body. Scheme shows classification of epidural space encroachment. A is scheme shows normal epidural space, and B is scheme shows mild ventral epidural space encroachment without spinal cord deformity, and C is scheme shows ventral epidural space encroachment with spinal cord deformity. We think A is suitable for microwave ablation plus osteoplasty, and B is suitable for microwave ablation plus osteoplasty and radiotherapy, and C is unsuitable for either. Case A, a 74 male patient. The primary tumor is renal cell carcinoma and the location is T6. From the pictures, we can see the lateral margin is incomplete. The VS score before the operation is 9 and the Franco is grade E. Post-procedure, 24 hours, the VS is 5 and the 48 hours, the VS is 3. The lateral margin is incomplete, and the lesion was showed in surgical and coronal CT. Enter along the left transverse joint. Repeated CT scans and reconstruction as imaging guided. The ball puncture needle is located in the center of the compressed vertebral body. Exit the needle core and coaxially insert the microwave antenna. Now it's located in the center of the body. This patient's ablation power is 40 watts and the time is 5 minutes. After the ablation, exit the antenna and insert the ball puncture needle. The position of the ball puncture needle is in the vertebral body. Exit the needle core and inject the ball cement 5.5 milliliters. This is a picture of distribution of the ball cement in sagittal and coronal CT. And case B, a 68-year male patient. The primary tumor is HCC and the location is T8. The lateral and posterior margin are incomplete. The VAS score before the operation is 7 and Franco grade is grade E. Post-procedure 24 hours, the VAS is 4 and 72 hours, the VAS is 3. Let's have a look at this vertebral body, and the ball puncture needle is located in the vertebral body. When the size of the lesion was more than 3.5 centimeters, the superposition of 2 or more energies could be published by repositioning the microwave antenna. The antenna reached the distal end of the lesion and ablated for 3 minutes. And then the antenna went back 1 centimeter and continued ablation for 1 minute. After the ablation, exit the antenna and insert the ball puncture needle. Confirm the position of the needle in the center of the compressed vertebral body in the sagittal and coronal CT. Exit the needle core and inject the ball cement 7 milliliters. And this is the distribution of ball cement in sagittal and coronal CT. Case C is a 70-year-old man with lung cancer with T3 metastases. The VAS score is 9, and Franco grade is grade D. The muscle strength of both lower limbs is grade 4. With the patient's consent, we performed the operation on him. After the operation, the patient's VAS score was significantly reduced. Muscle strength of lower limbs is grade 4, is the same as before the operation. So it gives him the radiotherapy. And from the MRI, we can see that T3 metastases, posterior vertebral wall is involved, and the tumor oppressed the spinal cord. This shows as CT images show the T3 metastasis with compression fracture. Tumor involved the spinal canal and compressed the spinal cord. Needle enter along the bilateral costal transverse joints. The ablation of this patient, the power is 40 watts and the time is 5 minutes. We use sagittal reconstruction CT. Image showed the position of the microwave antenna in vertebral. The amount of ball cement is 6 milliliters. And they show the distribution of cement in the vertebrae without leaking into the spinal canal. And the sagittal and coronal CT shows the distribution of the cement in the vertebral. In order to control the tumor, the patient underwent the radiotherapy. Let's see some cases with compression fracture. A 67-year-old female with esophagus cancer, 1 month after radiotherapy, T3 metastasis with severe compression fracture. Compressed fracture rate is 90%. The VAS score before the operation is 7. Spinal cord Franco is grade E. After the procedure, 24 hours, the VAS is 0 and no complications. Osteolytic metastasis and compression fracture. Needle was inserted into the center of the tumor by left costal-transverse joint. Spinal puncture needle was positioned in the center of the vertebral. And we use ablation power is 30 watts, and the time is 3 minutes. We can see the microwave antenna is located in the center of the compressed vertebral body. The amount of ball cement is 3 milliliters. And this shows the distribution of cement in the vertebral without leaking into the spinal canal. Surgical and coronal reconstruction CT images show the distribution of cement in the vertebral, and the compressed vertebral body restored its original height. We also have done many cases of multiple vertebral metastases. A 57-year-old man, lung cancer with L2, L3, L4 metastases. The VS score before the operation is 9, and spinal cord Frankel is grade E. 24 hours after the procedure, the VS score is 1. And from the MRI, we can see the L2 to L4 metastases and the L2 with compression fracture. And the upper endoplant fracture. It shows the fracture line. 3 spinal puncture needles were inserted into the vertebrae at the same time. Surgical reconstruction CT images show the position of microwave antenna in the vertebral. Sufficient amount of ball cement was injected into the 3 vertebrae. And septal and coronal CT reconstruction images show the distribution of cement in the vertebral. This technique has a good indication in cases of high thoracic vertebrae. For example, a 62-year-old man, T2 to T4 metastases of esophagus carcinoma after surgery and radiotherapy. Before the operation, the VS is 7, and spinal cord Frankel is E. 48 hours post-procedure, the VS is 0. Before the operation began, we choose the right approach of needle insertion and mark the puncture points on the skin. We often use an orthopedic hammer to type needles. We use 3 ball puncture needles to enter the vertebral body simultaneously. And this is the process of microwave ablation. We can see from this picture, surgical reconstruction CT images show the position of the puncture needles. We injected the ball cement very slowly and stamp by stamp. From this picture, we can see the surgical and coronal reconstruction CT shows the distribution of the cement in vertebrals. Paravertebral metastases are also the indication. For example, a 64-year-old man, L1 metastasis with lung cancer, the VS is 7, and spinal cord Frankel is grade E. 48 hours after the procedure, the VS is 1. From the picture, we can see L1 is osteolytic metastasis and the destruction of the posterior vertebral body. First, we first do the paravertebral lesion was treated with the microwave ablation, and the power is 40 watts, and the time is 5 minutes. And adjust the direction of the needles so that the needle was inserted into the vertebral body through the left pedicle. The lesion in the vertebral body was treated with ablation. The power is 40 watts, and the time is 5 minutes. And then after the ablation, the bulb cement 5 milliliters was injected. From the sagittal and coronal reconstruction CT, we can see the distribution of the basement. Summary. 1. Microwave ablation combined with osteoplasty is an effective and safe treatment for bone metastasis. 2. The combination of two treatments has a synergistic effect of anti-tumor and pain relief. 3. Microwave ablation was used before injection of basement to reduce the leakage of basement. 4. Choosing the right power and time is the key to prevent spinal cord and nerve injuries. That's all for our topic, and thank you for your attention.